What is fatty liver disease? Fatty liver diseases means you have extra fat in your liver. Heavy drinking makes you more likely to get it. Over time, too much alcohol leads to buildup of the fat inside your liver cells. But you can get fatty liver disease even if you don't drink a lot of the alcohol, and that is called as non-alcoholic fatty liver disease, NAFLD. There are two types of NAFLD. One is simple fatty liver. This means you have fat in your liver, but you may not have any kind of the inflammation in your liver or damage to your liver cells. It usually doesn't get worse or cause problems with your liver. Most people with NAFLD have simple fatty liver. Then NASH, non-alcoholic steatohepatitis. This is much more serious than just simple fatty liver. NASH, that is non-alcoholic steatohepatitis, means you have inflammation in your liver. The inflammation and liver cell damage that happen with the NASH can cause serious problems such as fibrosis and cirrhosis, which are types of liver scarring and liver cancer. About 20% of the people with NAFLD have NASH. Then alcohol-related fatty liver disease, that is ALD. Alcoholic fatty liver disease is preventable. It usually gets better when you stop drinking alcohol. If you keep drinking, ALD can cause serious problems. These include enlarged liver. It doesn't always cause symptoms, but you may have pain or discomfort on the upper right side of your belly. Then alcoholic hepatitis. This is just kind of inflammation or swelling inside the liver that can cause fever, nausea, vomiting, abdominal pain and jaundice, that is yellowish discoloration of your skin, eyes as well as urine. Then alcoholic cirrhosis. This is buildup of the scar tissue in your liver. It can cause the same symptoms as alcoholic hepatitis plus large amount of the fluid, that is ascites. There is swelling of the abdomen, blood in vomitus, that is hematemesis, confusion, disorientation and changes in behavior suggestive of hepatic encephalopathy, enlarged spleen, that is splenomegaly, liver failure, which can be fatal. Alcohol-related fatty liver disease usually comes first. It can then get worse with the time and become alcoholic hepatitis later on. Over time, it may turn out to alcoholic cirrhosis. Now, friends, we will discuss the symptoms of fatty liver disease. With ALD and NAFLD, there are usually actually no symptoms initially. Some people may have signs such as tiredness, fatigue, or pain in the right upper side of the abdomen where actually your liver lies. Causes and related risk factors. For alcoholic liver disease, the cause is too much excessive alcohol intake. For non-alcoholic, causes may be obesity, sedentary lifestyle, malnourishment, then chronic viral hepatitis, especially hepatitis B and C, hereditary or genetic risk factors, type 2 diabetes, high level of triglycerides or bad cholesterol, that is LDL cholesterol, or low level of the good cholesterol, that is HDL cholesterol, polycystic ovarian syndrome, PCOS, obstructive sleep apnea, hypothyroidism, hypopituitarism, losing weight rapidly, exposure to scented toxins and chemicals, metabolic syndrome. You may in metabolic syndrome you may have any three of these conditions such as large waist size, high triglycerides or LDL cholesterol, low level of the HDL cholesterol, high blood pressure, high blood sugar, fast weight loss. So taking certain medicines such as steroids, methotrexate or even gallbladder removal can enhance such conditions, which can actually aid in the fatty liver sometimes. Now, how would you actually diagnose this condition? Because most people actually don't have any symptoms initially, these conditions aren't that easy to diagnose. So you have to take the health history really in very detail. Doctor will ask about your alcohol consumption, what's the use, how much frequency you are having the alcohol. Then the doctor can also ask about medications, how you eat and other health conditions you might have. Then physical examination cannot be neglected. BMI, body mass index and palpable liver may give clues towards the fatty liver. Then certain blood tests such as high levels of liver function test such as SGOT and SGPT may be higher in your blood. Then imaging tests, ultrasound and CT scan, MRI. Then you can have liver biopsy. Not everyone just actually needs liver biopsy, and therefore liver biopsy is reserved only for NASH, non-alcoholic steatohepatitis. Last but not least, fibroscan is the newer entity with which you can diagnose the fibroscore. You can diagnose the resistance of the liver, and you can quantify the fat content. Now, treatment of fatty liver disease. The first line of treatment is just to lose weight. It helps to reduce fat, inflammation and scarring in your liver. Losing just around 5% of your body weight can cut down on how much fat is actually inside your liver. Weight loss surgery is also an option, that is bariatric surgery, if you have lot to lose. You will also need to quit drinking habits. It is the only way you can keep your liver damage from getting worse. You may even be able to undo some of the liver damage that's already happened. You may need a medically supervised detox program to safely quit drinking and manage withdrawal symptoms. If you have complications due to NASH, such as cirrhosis or liver failure, you may need to have a liver transplant. In general, people with NASH who get a liver transplant do survive really very well. Then self-care for fatty liver disease. Certain lifestyle changes needs, and they can actually help. Exercise more. Try to be active at least 30 minutes daily, most days of the week, at least 5 days a week. If you are trying to lose weight, you might find that it helps to really need to exercise more. Be kind to your liver. Don't do things that will make it work harder. Skip alcohol. Take medications and over the drugs only under instruction of certain like physician or doctor. Talk to your doctor before you try any herbal remedies. Just because a product is natural, that doesn't mean it is always safe. Get your cholesterol down. Eat a healthy plant-based diet, exercise daily and take your medications. This will get and keep your cholesterol and your triglyceride levels where they actually need to be. Now manage your sugar, that is diabetes. Check your blood sugar regularly at your home and take drugs as prescribed by your doctor. Then complications of the fatty liver. So friends, there are certain complications which need to be taken care of. The main complication for all these conditions is just cirrhosis, that is shrunken liver, or scarring of your liver. As your liver tries to stop the inflammation that comes with these conditions, it creates certain areas of scars with healing. As inflammation spreads, so do the scars, and eventually your liver can't do this job. That can result in cirrhosis and its complications. Fluid might build up in your abdomen in the form of ascites, swollen veins in your esophagus, that is dilated veins that can actually burst and bleed. These are called as esophageal varices. Some sort of confusion, disorientation or drowsiness might be there, that is hepatic encephalopathy. Liver failure, liver cancer. Now friends, can you just prevent this fatty liver disease? So to prevent alcoholic liver disease, drink in moderation. That's 1 drink a day for women, and men over 65 and up to 2 to 4 men 65 and younger. Protect yourself from hepatitis C. This viral infection can make you more likely to get cirrhosis if you actually drink. Check before you mix meds and alcohol. Read the warning labels and over-the-counter meds. Don't drink when you are taking products like acetaminophen, which can actually damage your liver when combined with alcohol. Eat healthy diet and healthy food. Choose a plant-based diet with lots of fruits, vegetables, whole grains and healthy unsaturated fats. Stay at a healthy weight. Lose the weight if you need to. If your weight is healthy, work to maintain it by choosing a healthy diet and exercise daily as a self-discipline routine. Exercise. Get a workout most days of the week. Talk to your doctor if you haven't been active in a while, and do certain yoga, pranayam, meditations as well as exercise along with diet. So friends, thanks for watching this video with patience. I just pray all you to be healthy, wealthy and prosperous in every sphere of the life.